Alright guys, I finally started to watch the Pitt, and season 1 episode 1 is here. So let's take a look. So this scene looks to me like kind of like a mass casualty incident here, like an MCI. But there's actually two patients coming in from, I think, two different accidents. So this looks like a bad degloving injury of the right lower extremity here, which they did point out. They called it a degloving injury. And then the other patient has a, what we suspect here, a traumatic brain injury. And they put a temporary airway in the field with the LMA, and the team begins to do their primary survey. Let's take a look here. So it's good because they do an E-fast. They check the pupillary exam. They're working on exposing the patient. And then again, the patient's in AFib, so they make a really good assumption that the patient's probably anticoagulated. The liver is what makes those clotting factors. So I always say 2, 7, 9, 10, never going to clot again. Those are the vitamin K dependent clotting factors. So again, this show is great because it's actually super clinically relevant and they give real medical information. So with this woman, she really has a distracting injury, and this injury of the right lower extremity is a mangled extremity. So this is a good time where we use what's called the MES score, the Mangled Extremity Severity Score. Because this case really, with that bad of an injury, this is considered a Gustilo-Anderson classification 3, because there's a large amount of surface area missing, and this is an open fracture, so it's a G3. So I'm a little disappointed that they didn't mention what antibiotic therapy they would give. And also with this, they're talking about just doing a nerve block. That's not really going to help in this situation, let's be honest. So this patient, to reduce that fracture in the real world, is definitely going to get conscious sedation. Oh, and then this scene's cool where they're intubating the patient. They're saying they can't manipulate the cervical spine. Good news. And then they say they're in, and actually when they say they're in, all you can actually see is a bougie. That blue tube is a bougie through the cords there. So they're really not in yet. They have to wait till the ET tube is in. They would slide the ET tube over the bougie, and then again, waveform capnography is going to be your gold standard there. And then of course, someone from hospital administration comes at the worst possible time. They're really good at that.